Good morning, good afternoon, good evening, everyone. On behalf of the International Diabetes Federation, I warmly welcome you to today's webinar on psychosocial well-being in schools for children and adolescents living with diabetes. This webinar also to commemorate International Education Day and celebrate 104th years of insulin. My name is Anita Sabidi, IDF Blue Circle Voice from Indonesia, and I will be moderating today's session. This webinar aims to introduce the concept of psychosocial well-being in the school environment, highlight the real-world psychosocial impact of living with diabetes at school, share life experiences directly from advocates, and discuss best practices that can help schools become safer, more inclusive spaces for children and adolescents with diabetes. We're joined today with a diverse audience, advocates, parents, teachers, school staff, healthcare professionals, researchers, and policymakers. Thank you for being part of this important conversation. Before we begin, a few housekeeping notes. Please keep your microphone muted unless invited to speak. You may submit questions via the Q&A or chat box at any time. This session is being recorded. Now, it is my pleasure to begin with a welcome from IDF leadership. We are honored to start with a recorded welcome message from Kyle J. Rose, Vice President of the International Diabetes Federation. Kyle will share opening remarks and set the context from IDF's global perspective.
Hello and bonjour. My name is Kyle Jacques Rose. I'm a Vice President at the International Diabetes Federation. I'm delighted to welcome you to today's session, From Stigma to Support, How the KiDS program tackles the psychosocial challenges of diabetes in schools. We're doing this, of course, around January 24th, International Day of Education, marking a global call to ensure quality, inclusive learning for all. And for us, it also really offers this opportunity to spotlight what we believe is an overlooked truth, often overlooked, and that's that psychosocial well-being is essential for students with diabetes to truly thrive. Children and adolescents living with diabetes navigate a range of emotional and social challenges that can be just as demanding as their medical needs. Anxiety, stigma in school environments, social isolation, pressure to self-manage, and concerns about body image or academic performance can often overwhelm their daily lives. At the same time, families and educators often feel unprepared, facing stress and uncertainty due to a limited understanding of diabetes and inconsistent access to the guidance and resources they rely on. And that's why we're really so proud of our KiDS program, as we feel like it's so important to try to address this. And the KiDS program, for those of you who don't know, is one that brings a diabetes education into the schools to reduce stigma and promote healthy lifestyles. We do this in partnership with ISPAD. Dr. Calliari is going to be speaking later in the program. Thank you for being here, Dr. Calliari. And this is also supported by an educational grant from Sanofi. The KiDS approach helps schools become safer, more inclusive environments for children and adolescents living with diabetes by equipping the school communities with accurate knowledge and practical tools, using interactive, engaging educational approaches that resonate with the students. And since 2013, over 1 million students have been reached by the KiDS program in 23 countries. We're going to get a chance to speak to some of the people who've been interacting with those schools across the world, including some ongoing implementation efforts in India. We're going to be sharing best practices to support psychosocial well-being in schools for children and adolescents living with diabetes, and hear directly from advocates in a panel towards the end of the session. We've got a fantastic lineup. I'd like to thank all of our speakers in advance, and as well as Anita Sabidi, who will be moderating the session. I think you're in for a real treat. This is such an important topic, and we stand 100% behind this tremendous need for young people around the world. I wish you a fantastic session and look forward to staying in touch with everyone who is involved.
Thank you very much to IDF leadership for those thoughtful and encouraging words. Okay, now to set the scene for today's discussion, we are joined by Dr. Eduardo Calliari, pediatric endocrinologist and member of ISPA's Special Interest Group on Diabetes in Schools. Dr. Calliari will share insights into the psychosocial impact of diabetes in school settings, drawing from ISPA's perspective, highlighting real-world data and experiences rather than a purely scientific review. Dr. Calliari, the floor is yours.
Thank you very much, Anita. Thanks, IDF and Kyle, for the kind invitation, and thanks for being here with us, with all the group. It's really important that we have this opportunity to be together. So just to set the floor here, I would like to say that we are from, I'm here representing ISPAD, which is this International Society for Pediatric and Adolescent Diabetes. ISPAD is a global organization dedicated to improving the lives of children, adolescents, and young adults with diabetes. And its mission is really advocate for better care and treatment for young people affected by diabetes. So, of course, all you know that type 1 diabetes is a chronic condition and requires insulin, glucose monitoring, diet, and activities management every day. And we know that children nowadays spend a large part of their day in school. So maintaining a good glycemic control is fundamental to avoid acute and chronic complications. And also going to school is an essential environment for psychosocial well-being. So there are some issues that patients with type 1 diabetes have to deal with. It's more common for people with type 1 diabetes to have diabetes distress, diabetes burnout. They have to maintain some resilience and coping. And there are some problems, some psychological problems that there are increased incidence in people with diabetes, like eating disorders, depression, and anxiety. And all this, with all this background, children go to school, and when they go to school, they have to comply with diabetes tasks. They may feel different, and they may have some difficulty engaging in diabetes self-management tasks when they are around peers due to fear of judgment and concern about social acceptance. So if they are from underserved communities, the picture is worse because they face some competing priorities related to socioeconomic status and environment, which puts them in risk for adverse health, psychosocial, and academic outcomes. And when these students have diabetes, the demands of managing the condition are an additional stressor. And this can result in higher HbA1 levels, in more frequent episodes of DKA, and early onset of complications. So when they are arriving at school, they find some peers that don't know about diabetes, that may have also their fears or be misinformed about type 1 diabetes, and sometimes may react inappropriately. The same happens with teachers and other school personnel that may want to protect these children, avoiding risks and also avoiding regular activities. So children with diabetes sometimes are not allowed to participate in all the possibilities inside the school. And so we have to fight this stigma that I would quote here as a negative stereotype or label that is applied to a health condition that leads to discrimination or exclusion. And the idea of this seminar that I really applaud IDF for bringing it up is for us to discuss how to diminish this. So there are some common psychosocial barriers which are related to lack of knowledge about diabetes, misunderstanding leading to stigma or exclusion, fear of hypoglycemia, anxiety, social isolation. And all of this can negatively impact attendance, performance, and quality of life. I don't know if you all know this hierarchy of needs. That simply shows that if you don't fulfill the basic needs, which are safety needs, psychological needs, you cannot learn well. So if we're talking about health, school is a very important place for us to take care of the children's health. But also they are there to learn. And for them to learn, we need to make a good environment for them to be safe and for them to think about what's important when they are in school, which is coping with friends and learning new things. Of course, when you think about schools worldwide, we have different concepts, structures, environment, we have private and public. So just imagine that within this context, when you have diabetes, this all changes a lot. So it's already different, and with diabetes, things change a lot. So that's why ISPAD started to create a special interest group in diabetes in schools in 2021. We meet every year, many times, and we have also our meetings, our ISPAD meetings in Abu Dhabi, in Lisbon, and last year in Montreal. And during this time, we discussed how can we help these issues that children have when they go to school. So we have lots of important ways of acting on this. And the aim is that the absolute minimal level of diabetes care at school in all countries includes the principles to uphold the students' right to attend school safely. So briefly, just for you to see that we have a survey that we did in 71 countries with HCPs. This was coordinated by Professor Karin Lange, who is a psychologist in Germany, and which showed that when you ask the healthcare professionals about diabetes in schools, they also perceive that there is a huge heterogeneity in the rights and the care. There is a great need for help in informing school staff and a high need for awareness and legal support in some countries. We also did a research coordinated by Laura Cudizio from Brazil with more than 7,500 respondents from different income countries, and we showed that 52% had at least one member of the family reducing working hours, which impacted psychologically all the families. The majority of schools don't have a staff member responsible for diabetes care, and most of the people are dissatisfied with diabetes care in school. So it's important for us to understand before we start to act. And because of this, ISPAD has also a consensus guideline. And in this consensus guideline, we have many ways of management and support children with diabetes in schools. It's for free, it's in ISPAD website. And there we show a little bit of how the school team, the healthcare team can join with the connection of the student and the parent to make the environment of school a little bit better for children with diabetes. And we also launched an ISPAD position statement, which is something that was coordinated by Peter Goss and Gunfor Sander with the participation of the other members. And it's very important because if you need to ask for something, to advocate in favor of children with diabetes, sometimes you need some guidance, you need some statement that you can bring to the politicians for them to change things. So we have this in our position statement, where we discuss the importance of schools' role, the legal issues, the cooperative and supportive partnership, and we also discuss a little bit about training the school personnel. So here, just for you to see that we have a practical chart that we developed talking about level 1 education, which is learning, recognition of signs and symptoms, level 2 education and start training on how to measure glucose, and also a level 3 education and training about how to inject insulin. So we have a whole bunch of information together there for you to use and to teach the schools. We also developed together with IDF a diabetes management plan where you have many information about all these issues, monitoring hypo and hyperglycemia, exercise, and etc., where children can bring to the school a management plan when school understands what is necessary for them to be cared of when they are at school. And also, when we talk about education material, we did a survey with the people who are participating from our chat, from this group, and asking this question, who will provide information, what resources should be used, and we noticed that there was a lot of important initiatives in many countries in the world, many countries in Europe, and all these places here, they have specific material. But here, as a representative of ISPAD, we would really encourage everybody to use the Kids and Diabetes Schools program, because it's a validated program. We could participate in the first initiative that we had in Brazil and India, and this was an experience with interaction with children, with teachers and professors. We could publish this, so it's a scientifically proven project, which is showing that the impact is very positive when you do this kind of program inside a school. So you have lots of material that you hear about from in the next talk. So just to show you that the information is there, you don't have to create anything new, and it's something really important when we talk about in this educational day on how to educate peers and educate teachers about diabetes. So finalizing my part here, the strategies to use in schools should be based on trained teachers on diabetes basics, educate peers to build empathy, implement policies, and promote open communication among students' families. And the result, we believe, should be to improve confidence, to reduce anxiety, and to have better social inclusion for children with diabetes. So our key messages here is that support in schools isn't optional, it's essential for psychosocial well-being, and that stigma in schools is real but addressable. Education empowers teachers, families, and students, and with awareness, we can turn stigma into support. So I invite you to explore kids' material and ISPAD guidelines, and I also invite you to come to Brazil. We'll have our ISPAD meeting in 2026 in November, and we will have a whole discussion, a whole table, a whole symposium to discuss diabetes in schools here. So I invite you all to come and join our Congress and to discuss all the things about diabetes in children and adolescents. So with that, I thank, in the name of ISPAD and the ISPAD Interest Group in Diabetes in Schools, I thank the International Diabetes Federation for the invitation, and I hope I could show you how ISPAD is committed, together with the IDF, to try to lessen the burden of children with diabetes in schools. Thank you.
Thank you, Dr. Calliari, for grounding today's discussion in lived realities and reminding us that schools are not just learning spaces, but also emotional and social environments. Next, we will hear from the IDF team, who will introduce the KiDS program and related resources designed to support psychological well-being for children living with diabetes in school environments. This session will highlight how structured education and school engagement can reduce stigma, fear, and isolation. Over to the IDF team.
Thank you so much, Anita. I would like to briefly introduce myself. I am Daniela Franco. I have a law background, a focus on human rights, and I am currently coordinating KiDS program at the IDF. And here I will call it simply as KiDS. So next slide, please. Perfect. A brief introduction of the program KiDS aims to bring diabetes education into schools. The main idea is to reduce diabetes-related stigma and to promote healthier lifestyle among children and adolescents to tackle these modifiable risk factors for type 2 diabetes. The program is implemented in partnership, as it was said, with ISPAD, International Society of Pediatric and Adolescent Diabetes, and it is supported by an educational grant from Sanofi in collaboration with the International Diabetes Federation. It is important to say that since 2013, KiDS resources have reached more than 1 million students across 23 countries, which shows the global impact and relevance of the program. The next slide, please. Thank you. Now moving to the second part, I would like to focus on stigma and well-being in schools. When we talk about psychosocial well-being, we are referring to several key aspects, such as emotional safety, self-esteem, peer relationships, and the ability to cope with stress and stigma. For children living with type 1 diabetes, stigma can affect how they feel about themselves, how they interact with their peers, and how confident they feel managing their condition in public spaces like schools. This is why schools are considered a key intervention setting. Schools shapes children's daily experiences. They influence how children manage their health, how included they feel, and how they participate in physical and social activities. Well-being at the schools is also linked to long-term health outcomes, specifically for children who need to manage a chronic condition on a daily basis. In this context, KiDS training sessions delivered in schools play a crucial role. They help address these challenges that children with type 1 diabetes can experience. by increasing awareness, reducing these misconceptions, and creating a more supportive and inclusive school environment. And to finish this part, KiDS is not only about diabetes education, but also it's about promoting dignity, understanding, and well-being for children in schools. Now, going to the next slide, I will give the floor to my colleague, Chris.
Hello, everyone. Thank you, Daniela. I think Dr. Calliari, thank you. He also mentioned a bit of the KiDS resources, but I'll go a bit in depth on them. Also provide the QR code so you guys can access them if you want. But just to give a brief, thank you, Daniela, for the introduction on the KiDS program. And these are the resources specific from the KiDS program that are free on the website. I'm going to share them on the chat as well, just in case somebody cannot access them. Here we have the implementation guide. But the implementation guide is basically the first step in wanting to implement a KiDS resource, a KiDS session, sorry. It has everything from the beginning, so like how to contact the schools, things related to privacy. Of course, these are schools where children have their rights protected. To the end of a session, anything related to how to evaluate the session, how did it go? So yeah, if you wanna just get a bit of a feel of how a KiDS session would be implemented in your case, this would be a great first resource to start with. Then the next slide, please. We have more resources here. These were also before the rebranding. So first we have the information pack. I will also be sharing all those links on the chat, so no worries about that. But if you want to start checking the QR codes, feel free. But the information pack is a pack specifically for teachers, school staff, and parents. This is all information related to diabetes, specifically in the context of children and schools. And this is an educational resource. Then we have the well-being guide. It's for adults in general, but it's more specific on healthy habits and the importance of healthy habits for diabetes management in the lives of children, but also just in prevention in general. And finally, we have quite an interesting resource. It's personally my favorite because I've seen it in person as well. But it is a comic book. This is specifically for children. This is specifically for the students. And it engages the story of Tom and his diagnosis and everything that comes with it. So first the symptoms, the diagnosis, and managing the diagnosis. What is really interesting about this comic book and what I think it does really well, and it's very important for today's session specifically, is that it is not only a clinical resource. It's not only medical. It also focuses on how, the diagnosis affects Tom's life in terms of social life and in terms of, just relating to his friends in school. So I think this is a pretty interesting and important resource. I think Bear will be sharing it as well on the chat, but this is very interesting if you want to share it with any kids of the sessions. And then next slide. Finally, we have the class plans. The class plans are just what it sounds like. It's the structured way of how a KiDS session happens. We have two class plans. Class plan 1 is 1 hour, class plan 2 is 2 hours. We know that, there's different times for everybody. Each session cannot be 2 hours, even though it would be great. But these ones are, as well as the implementation guide, a step-by-step. Everything is well guided. Every exercise is well explained. We always try to make sure that the exercises are engaging and gamified. So children can, be more engaged in the session, and it doesn't feel like another class. But something very important, I think, also in the class plans that it's also mentioned in the other resources as well, is that we offer a way for you to measure the impact of the session. So in terms of knowledge about diabetes and stuff like that. And if you want to implement a KiDS session, you don't know how, you have all of these resources. We're also available as well if you have any questions. And just as a final note, we would love to know if you decide to implement a session, so you can just contact us. We have a feedback form as well. Just now leaving the floor, I think Anita, you will present them, but it is Blue Circle Diabetes Foundation who are doing specifically the KiDS session. So go ahead, Anita, how are you?
Okay, Thank you, Christina. Thank you for showcasing how structured programs can translate policy into practical, meaningful change for children and schools. We now move to lived experiences and community leadership. It is my pleasure to welcome Nupur Lalvani, IDF Blue Circle Voice, Diabetes Foundation founder, and Savita Chavan, who will share highlights from the KiDS Maharashtra pilot focusing on psychosocial aspects of diabetes in Indian schools. Their experience demonstrates how local initiatives can drive national level change. Nupur and Lalvani, Nupur and Savita, please go ahead.
Thank you, Anita. It's great to see all of you. Big thank you to Team IDF for having us here. And incredible to see over 400 people in this call. So congratulations and thank you for all your commitment, everyone that has joined this call. Over the next 10 minutes, my colleague Savita and I will, run you through our learnings from the KiDS pilot in Maharashtra. But before that, I'd like to quickly share a little bit about myself. I also live with type 1 diabetes. I've had it since I was a school child. So this topic is, close to the heart, like it is, I know, for Anita and all of our, the young leaders, past and present. I'd request Savita as well now to quickly introduce herself.
Okay, my video is disabled by the host. It's showing that message.
Perhaps you could try turning it off and on. Yeah, there you are.
Hey, yeah, I can finally
Hi,
see it.
Savita.
Okay. Hi, Nupur. Hi, Anita. Hi, Christina, Dania, and everyone. Thanks for having us here in this wonderful webinar. I'm amazed to say the work that's been going on uh, to reduce the stigma around diabetes and for kids especially. And yes, myself, I'm Savita Chavan, and today representing Blue Circle Diabetes Foundation as implementation lead for KiDS program uh, as a pilot project in Maharashtra. So yes, so can you move on to the next slide? So it's been uh, almost 7-8 months. We've started this KiDS implementation in the schools across Maharashtra, and if we can move on to the next slide, we can see the numbers.
So,
Yeah, so
Savita, a quick question. I know, for a lot of our friends, you've probably seen photos and videos of the, kids program being implemented in the state of Maharashtra in India. So, I'd like to ask Savita, how does it feel to take this project to different parts of Maharashtra, which is a huge state in India? As you can see on the screen in front of you, we've covered about 1/3 of the state. And how does it help reach children who may feel invisible or unsupported? And what and who helped enable this outreach?
yeah, sure. So I really feel proud because my journey with diabetes started as a caregiver to my young daughter. She was just 2 years old when she was diagnosed, and my journey was pretty much traumatic, and it was a very difficult time. So starting the same role for the other kids, supporting them, and now it's the pilot project is running in Maharashtra. I feel immensely proud to take this up and interacting with schools, interacting with children. And as a part of Blue Circle Diabetes Foundation, we had been, as you know, that we had been doing the school programs already. And since we had good reach with the people and good connects already established, um, yes, it was pretty much challenging reaching out to the schools and getting their time and everything settled for the kids program. But yes, a shout out to our volunteers spread across many districts across Maharashtra. It did help us, the connects initially that we had set up. And yes, uh, it went on many calls, following up with the schools, and so far we could touch upon 12 districts in Maharashtra. It's like one third of Maharashtra, almost being a third largest state in India.
And just adding to what you've said, Savita, what we're really grateful to IDF for the support, because taking the kids program to not just urban schools and city schools, the right to health and the need for dignity, like was just mentioned a while ago, and support is for every child in every school, whether they're from a village or a big city. And that's really helped us to translate that and take that even to smaller places and villages across the state of Maharashtra. Next slide, please. Also, Savita, what psychosocial or attitude changes have you noticed? You've been there in every school program, and what changes have we seen? Be it the staff or the students or the parents. Have you noticed a shift once the session takes place? What sort of difference have you seen in these people?
Yeah, as you mentioned, Nupur, that's the beauty of kids program, that it is not limited to urban setup, and we could reach out many schools in rural areas of Maharashtra as well. Many tribal areas, I would also mention specifically. And out of 48 schools that we reached out, 18 schools were government aided schools, a very small simple setup. So we did localize kids program for the schools, because they understand very simple language. They may not understand the technical terms related to diabetes. But yes, initially it was very difficult to convince them to conduct the kids session, to get their time, because of unawareness about diabetes. And they might not understand, oh, we don't have any diabetic child in our school, so why should we conduct this program? Like that, this kind of response we did get initially. But after conducting the kids session, we observed that many schools also requested us to conduct the sessions for parents separately, also for their staffs. And some of the places, even people, the school requested us to conduct these sessions, diabetes awareness sessions, for at the community level. So I feel that's certainly making a good impact for the children. And conducting this awareness session, although there might be some cases, undiagnosed cases, that we might be missing on, that the child is going through certain symptoms. So talking about symptoms of diabetes, and setting up the sensitized, empathetic, and compassionate um, society for this children is very important for their overall growth.
Thank you, Savita. And on the slide here, you'll see we've reached out to over 22,000 students from the first until the 10th grade, over 96 sessions and 48 schools. And there are still so many stories that jump out and stand out. One of the rural schools that we went to, we conducted a program there, and, India is a culture like many other cultures of great hospitality. So when you visit the school, the principal and the teachers will often, give you some snacks or some tea or coffee. And the principal was preparing to organize some sweets for us as volunteers who were there to conduct the program. And after the program took place and we spoke about a healthy lifestyle and healthy eating, the sweets were quickly taken away and they were replaced with apples and fruits. So we could see a
Yes, I
real time.
remember that.
Exactly. We could see a real time shift in the attitude right there. Another important thing, and the next slide, please, if I could request for, how does the kids project, Savita, adapt its messaging for government schools and rural schools where it's sometimes difficult, to conduct maybe some sort of programs. What I really like about the kids project is that it's really simple. So any of these 400 people that are watching this session today, even if you see the recording later, it's very, very easy to conduct a kids program. You don't need a lot of complicated things. A school that even has just a blackboard and chalk, you can conduct a program there. And I just want to reiterate what Dr. Calliari said earlier. All of the implementation guide, all of the resources are existing. You don't need to create anything from scratch. So Savita, over to you. What part do you feel could be a challenge for large classrooms or limited resources, such kind of settings?
Yeah. So, yes, at some places, some schools, we did a little bit customization if we had to conduct the kids session for larger audience. Okay, because it might get become chaotic for uh, the situation. Because this might be a very new topic for them, coming all the way all together about diabetes, which they were thinking, okay, this just about sugar, eating sweets, eating sugar. Okay, and when we start sharing the facts about diabetes, overcoming the myths, it might feel little overwhelmed for the audience, especially for the young audience. So yes, we did some customizations and made it simple for them to understand in local language, stories. And many times our volunteers also helped, some of our T1 volunteers, people living with diabetes, and young volunteers, so they could relate to children more, those who are talking out of experience, their own living experience with diabetes. So yes, that also helped them to relate. And also, it is important for the children to understand that diabetes is non-contagious uh, condition, health condition. And many children initially would come to me and uh, and ask, ma'am, if my any of my family member have diabetes, or any of my friends in school have diabetes, will I also get that? That was very innocent question, that coming from kids. So I'm happy that we are able to overcome this query and this doubt for the children, and they should feel safe having their peers around. And it's not just about sugar and sweets, because children do love eating sugar and sweets at times. And it's perfectly fine. And there are types of diabetes that we deal with, and there are reasons of getting diabetes. So overcoming the myths for children help them, to feel safe and secure.
Absolutely.
And
Thank
these,
you.
as you can see, there are some sheets. This is one of the letters that I got from one of the schools that we conducted kids session in. So you can see the children are interestingly drawing the pictures of things that are related to diabetes supply. And one of the child replied that, okay, she finds T1 children very brave, that she mentioned in the worksheet that we had given for the children.
Thank you, Savita. Requesting for the next slide, please. Thank you. It's all right if you take away the slides. We are just in the last 1 minute of our discussion. Feel free to stop the slide sharing. As we end this discussion, I'd like to, touch upon the topic of why addressing stigma is so important in school settings, and why must diabetes education in schools go beyond just facts and figures and numbers, and it must also include emotions and empathy, and support from friends and teachers and the principal. So Savita, as closing thoughts, is there anything you'd like to share?
Nothing in specific though, but yes, I'm really happy to be a forefront for kids program, and interacting with thousands of kids, and solving their innocent queries. It's been wonderful experience altogether. Thank you.
Absolutely. So back to you, Anita. Thank you very much for having us over.
Thank you so much. I mean, thank you both for this powerful insights. I mean, your work closely shows that psychosocial well-being is not optional; it is essential. Now we move to our panel discussion and Q&A, where we will explore perspectives across regions, disciplines, and lived experiences. I am pleased to introduce our panelists, Ousman Ceesay, IDF Young Leader in Diabetes trainee from Gambia, Estefania Malasissi, IDF Young Leader in Diabetes alumna and medical doctor from Argentina, Naser Altooblani, IDF Young Leader in Diabetes mentor and psychologist from Bahrain, and Dania Makkawi, IDF Young Leader in Diabetes trainee and school science teacher from Egypt. Thank you all for joining us. Okay. So the first question will be, how did living with diabetes impact your physical and mental well-being and emotional safety in the school?
Someone? Well, hi everyone. I'm Estefania, as Anita said, from Argentina. I live with type 1 diabetes since the age of 2. So in my case, I went to kindergarten with diabetes. I went to primary and secondary school.
Oh.
And in my case, diabetes was like something else in my life. And what I loved about my school time with diabetes is that my mom and we were always sharing something about diabetes with my friends, with my teachers, with everyone. So it was like sharing something of my life, but it was also normal for my friends. I mean, they always were like, you have to inject your insulin. Oh, you have, I don't know, your 100 glucose there. And they were all like celebrating when I was in range. So I think when we can share and we can live our diabetes with the people who is around us, it's easier. And it's the way we are going to face our diabetes when we are adults. I mean, if our life with diabetes is normal, as it used to be, or it has to be, if it is normal with all our people around when we are kids, it will be normal when we are adults.
But you're amazing. I'm so proud of you. And I'm proud of your mom as well. So, Naser or Ousman or Dania is next. Want to share this? Ousman?
All right. Hello.
Oh, hi. Hi, Ousman. Yes, you're next.
Yeah. All right. Okay. How did what is the question again?
How did living with diabetes impact your physical and mental well-being and emotional safety in school?
In school. All right. I think living with diabetes in school was a full-time mental and emotional job. Not just as a medical one, but from life experience, these practical, like realistic steps can help students protect their mental health while managing diabetes, especially in schools like settings. So like what I did was like I learned my body and I trust it. Like know the early signs of low and high sugar and act as early as possible. And I don't ignore symptoms just like I fit in. No, my health first. And it also reminds me that like I have to remind myself needing care is not weakness. So I think those are self-confidence that reduces anxiety. I speak up even when it is unfortunate. When I am not comfortable, I inform like at least one teacher and also one friend about diabetes, and I practice simple sentence like I need to eat now because my sugar is low, because I was so very young and I didn't know a lot by then. So those were the things that I was asking for help is strange, not same, honestly. Like to ask for help was not something that I was shameful of. No, no, no. It was strange. And I think people love me with that. So silence increase stress. You know that? And
Yes.
communication reduce it. So those are the things that also help me. And one thing I do is I prepare to reduce stress. I carry a small diabetes kit, example snack, insulin, strips, and I
Yeah.
call it my life. I call it my life. So I think those are the kits that really help me. I plan ahead for exams, sport, and long school days. And preparation gives me control, and control protects mental health.
True.
So those are the
Yes.
things that really help me. Yeah. Thank you.
I completely agree with you, Ousman. Wow. But you manage it well, very well. You can communicate about your hypoglycemia, your hyperglycemia, that you need to bring your snacks, your insulin to your friends in schools. That's amazing. I mean, with all
Yeah.
the circumstances happening,
Mhm. Definitely.
wonderful. Can I have Dania?
Yeah.
Can you hear me?
Thank you. Yes, can hear you.
Okay, I'm glad. First of all, I want to say that I'm very happy to be here today as part of the kids program. I'm a school teacher myself, so being here has a great impact, especially I'm originally from Sudan, but I'm living in Egypt.
Yeah.
And to see that there are programs that needs to be implemented in school coming from my country. We never had that. We never had that in school.
Yeah.
So it's great to see this happening. Speaking about my experience in school, I wouldn't say that we had this education or knowledge about diabetes. Um, in fact, it was more of your parents has to warn the school about you not taking sugar, and you're not allowed to
Yeah.
buy this, and you're not
Yeah.
allowed to buy that, and you're a child, so you don't understand why isn't your body functioning like everyone else.
Yeah.
You feel restricted, you feel different.
Yeah.
There's also the lack of understanding and the public discipline. Because as a
Yeah.
kid, when you warn the canteen lady of not selling you sweets or etc., this only creates
Yeah.
a feeling of you're being told no without proper explanation, if I can say
Yeah.
it. You don't understand why your body is not functioning like others, so it creates
Yes.
confusion and emotional distress to some extent,
Yeah.
and a sense of isolation as well, because you're not like your peers. And in fact, in every situation, you have to be dealt differently with, you know. And I was an introvert at school, so the unwanted attention that this brought to me was something that was overwhelming, and it
Yeah.
was deeply uncomfortable. And knowing now that there are programs that help with this, and teachers being educated about this is something that is great, and I'm very happy to see this
Definitely.
happening. Yeah,
Yes. Completely agree. Oh, how are you now?
I'm good now. No,
Lovely
you
to hear
grow up,
that.
you understand, and things get better.
I'm happy to hear that. So I have the last panelist, Naser.
Yeah, thank you, Anita. Thank you, everyone, for being here. I'm Naser. I'm from Bahrain. I'm a clinical psychologist. I've been living with diabetes for, don't know, a long time now. I was diagnosed at the age of 2. From my experience, I think it was obviously it came with a lot of its challenges, and kind of I think the diagnosis at the age of 2 kind of also made it the norm. And I liked also what Stefania reflected on. It was
Yeah.
like the um so to me, it was also empowering to also educate people around me about what diabetes is. Why do you have to take your injections now? And why do you have to control how much carbs you eat? And why do you have suddenly to go to the bathroom or drink water? But sometimes it comes with its challenges, obviously. And I remember the times when it's like a huge exam hall and I had to get up and have kind of a juice box, or have to get up and go to the bathroom, and teachers or students would ask. And obviously that would bring a lot of frustration to me, but I kind of couldn't have waited a bit before this hypoglycemia episode or before going to the bathroom. So it would obviously come with its challenges. And also reflecting on it right now, even in the clinic, sometimes when I have a hypoglycemic episode and I'm in the middle of the session and someone is talking about very difficult feelings that they're facing, kind of having to get up and do something about it. So obviously it would kind of reduce my capacity to handle the daily frustrations that also could potentially come with school. Yeah.
But here you are now. I'm sorry. I have to applaud for everyone. I'm
Thanks,
so proud of you.
that's very sweet of you. But obviously, like these
Wow.
challenges, I think allow us to understand so much more about how help can be done. And I was a teacher myself before becoming a psychologist, and talking about what Dani was talking about how it's so supportive and trying to support our peers either through educating individual students or teachers, like what the kids program is doing. And a lot of these things obviously come from trial and error and the challenges that we face in the past, right?
Yes, providing a safe space for us. Whew, okay, try not to cry. Next question. How did the challenges you faced affected your confidence and self-esteem? I'll go back to Estefania.
Great. So I think that it helped. I think that this helped me to be who I am now. Now as Naser said, we were like 2 years old, and we have to start facing injections and measuring our glucose and living this life inside the world that it is not prepared for people with diabetes. So nowadays I'm part of Cuidar, that is the Association for the Care of Diabetes in Argentina, and we work a lot trying to help people to have a better life with their diabetes. And I think that I wouldn't be working on this if my diabetes wouldn't appear. I wouldn't be a doctor if my diabetes wouldn't appear. So I think that diabetes helped me to grow up faster, and also
Stronger.
to be and also to be maybe stronger. We have ups and lows, and sometimes we are angry and stressed.
Yes, very strong.
Everything. Yeah, exactly. But we learn how to fight in a good way this life since we were young. So I think diabetes was a little bit positive for me, or
You're
for my
amazing.
adult Estefania.
I think everyone is amazing in this panel. I mean, it's wow. I'm listening to your stories. You're real like really young, and I'm really proud of you. You have to know that. Okay, Ousman, you're next. Ousman, are you there? Or shall I go to? Oh, you're there. Okay.
Yeah,
yeah.
Thank you so much. And I think to talk about confidence and also the academic part, right?
Yeah.
So from my life experience, the biggest psychosocial challenges for students living with diabetes in school, understanding.
Yeah.
Like before, I was labeled as someone sick, or the sick boy, the diabetic boy, or I will blame for my own condition, and this leads to shame. Hiding my insulin use. When I use insulin,
I did that
I need
too.
to hide to inject myself.
Yes.
Definitely. Or I can even avoid glucose checks and stuff. So confidence drops when me as a child feels different or judged. So I think that is one, the stigma and misunderstanding. And the other one is fear of being seen as someone weak. I play football. I am always seen as someone very, 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 very weak. And guess what? After they will bring me inside the football field, I will perform more than others. And that is a big message to them that, okay, as a diabetic, I am not weak.
Yeah.
But if you give me the support, I'll be someone having sweets or snacks in my bag before going to the field, and also the my other mate in the school giving me the support over time. This affects the self-esteem and willingness for me to participate. I think it is also the fear of being
misjudged, misunderstood.
Anxiety around hypoglycemia.
Yeah.
Like the constant fear of ruining exams or class, it creates stress and distraction. And this anxiety reduces concentration and my academic performance. It disturbs a lot. And lack of school support. The school management need to support you first before the students. I think when teachers or even insulin and feeling unsafe or unsupported directly impacts my learning and my attendance in class. So the other one is the the emotional burnout. I think that one is also very important. The emotional burnout, managing diabetes daily while
24/7. Yes.
up academically is exhausting.
Yep.
24/7. Burnout can lead to poor self-care, frequent highs and lows, and miss school workouts. And I always miss a lot of workouts. So impact on confidence and academics. These challenges I draw from a lot of activities, a lot of like plays. Example, the school team. I was withdrawn from the school team because I was diabetic, and it reduced my confidence. But over time, I gained that confidence, and today all is well. Yeah, thank you. That's what I had to say.
But I'm happy to see you here. Seriously, Ousman, you're tackling everything right in front of you. Dania, you're next. Thank you, Ousman. Dania.
Building on what Estefania and Ousman said, as Estefania said, you end up growing up too fast. At some point, being forced to take adult responsibilities at a very young age, without having the proper explanation on why you're doing this, and you constantly have to monitor your body while trying to keep up academically and socially with everyone else. When you grow up at this point, you get to see the strength that you had to have in order to go through all of this. I would say, looking back at myself, I feel very proud. I feel very confident now. I see the strengths that are needed in order for you to live a life with diabetes. As a child, it's very different, as Ousman said, the stigma, being withdrawn from activities, the attention, the unwanted attention that this drives to you, and being diabetes becoming your first identity. Like, this is the first thing that someone notices about you, especially in schools. So, I would say now you grow up more confident, you get to see the strengths, you get to see, you get to be proud of yourself.
Yes.
Yeah.
I completely agree. Well, I'm in awe because because I also diagnosed when I was a kid, and in schools it's difficult. So I mean that's why when you tell the story, it's really close to heart, because I've been in that shoes as well. It took time. It took time to gain back our self-esteem and confidence. It takes time. Naser, you're next.
Thank you, Anita. I think a lot of what the panelists mentioned is resonated with me, and especially the part about which echoing what Dania and Stefania were talking about there is a lot to juggle at this point, and that's something that I talk about in my advocacy in the workshops and the clinic as well, about the child who's diagnosed with diabetes at a very young age. They go through a very unique experience of having to navigate a lot of things at once. So if their peers or classmate in school has to navigate academics and a healthy household, a lot of the times the kid who's diagnosed with diabetes, they'd have one additional thing, let alone if it's compounded by difficulties in socioeconomic levels, compounded by family conflict, or an anxious parent, or what we call them as diabetes police. Every time you can eat this, right?
You don't eat that. literally that.
And it gets compounded, right?
Yeah.
A lot of
Yes.
times it has this exponential effect, and I think a
Yeah.
lot of the time can kind of hit kind of where it
Yeah.
well
Yeah.
in the self-esteem and the confidence because of what
Yeah.
Ousman talked about in terms of emotional burnout. To me, I think my experience was also a bit potentially different. I think a lot of the times how my diabetes was used in my sense was also to advocate for it, to talk about it in my diabetes society back home. There was in school, it was within my family, and obviously the support
Yeah.
of my parents there, I think, was very instrumental. But I think a lot of the times it has become one of the kind of main tools that I've used to also kind of become who I am today in terms of being an advocate or a psychologist or a teacher. It's a lot of it was about, I think, teaching people what diabetes is about and relating to their stories from a very young age.
Okay. Okay. Everyone, please inhale and exhale because another question will be interesting. So, are you ready for the next question? Okay. Next question. Okay. Do you feel that having type 1 diabetes made you more mature than kids your own age? You can go first, Naser. I think it's in your head already.
Thank you for yeah, it was, and I was thinking about having too late to answer that. I was just kind of thinking about how, what we were just talking about, actually, about how that kid has to navigate so many more things.
Yes.
And obviously,
Yeah.
as part of the diabetes, a part of what Dania was saying, that all the time that kid would have to be scanning. You'd either be scanning
Yeah.
your body, either have to be
Yeah.
scanning your blood sugar, you'd
Sure.
either have to be scanning your environment, whether there is, juice, whether there is, a bathroom
Yes.
close by. So I think a lot of the times it might, and I think a lot of the times it has the capacity to. Yeah.
True. I agree with you because, I mean, I can imagine me myself as a kid, and then I have to tell the adult that I'm having hypoglycemia. I need to treat my hypoglycemia. I mean, which kid do that? I did that. I was like, I think no other kid did that. I mean, yeah, trying to advocate ourselves in school. It's a mature stuff. I mean, it's for a kid. It's a lot of things going on. Okay, Estefania.
Yes, I would say, as we talked before, we are like big kids, no? We are like growing up fast.
Yeah.
But I want to also say thank you to our parents because most of us, we are little kids with 2, 3, 4, 5 years old, and our parents has to be there. They have to
Yeah.
think about our insulin. They have to think about our breaks at school. They have to think about sports when we are kids and we want to play and we want to do the same things that our friends do. So
Yeah.
I think we grew up fast and they also grew up fast as parents because
Yeah.
I'm sure they didn't imagine that they were going to have a child with diabetes or with type 1 diabetes. So I think all the family, also our brothers, sisters, I mean all the family, we all grew up fast. So I would just add that.
Ousman?
Yeah. Can I
Yes.
have the question again, please?
Okay. The question is,
Okay.
do you feel that having type 1 made you more mature than kids your own age?
Okay.
Yeah.
That's a very, very, yeah, that's a very great question. I think with my life experience, with my diabetes journey, I think the question is already answered. Like I was diagnosed when I was 11 years old.
Yeah.
And if you can, like, if I can remember, I cannot remember a lot, but like my mom who entrusted my life a lot. And also for me personally, diabetes at 11 and diabetes at 26 now, there's a lot of difference. I had everything in my life living with diabetes. I think it is very great. Like I completed my school. I went to a football team. They discriminated me. like that stigma still, I still live with that. I think those are the things that always make me mature, to think positively, like the strength,
Yes, and keep
the
moving forward. Yes.
determination. Yeah, the
Yes.
determination, the resilience. It makes me
Yes.
like to think about escapism. It really, really, really helped me a lot. So I think that's it. I also introduced my own clothing brand, like all is well, like never before. Before was very hard. I don't know nothing about diabetes. I didn't have the knowledge. I didn't have like the confidence. I didn't have the resilience living with diabetes. But growing up, the maturity helped me like to live better, to know better about diabetes, to know how to use my insulin, how to like inject myself, how to store my insulin. I think those are the stuff that makes me more mature. Like, okay, changes
Yeah.
me personally. I am a very, very, very changed person because of that diabetes. So I think like that question really, 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 really touched me now, and I can just say all is well like never before. Yeah,
Yeah.
definitely. So that's it.
Thumbs up. Dania, your turn.
I think when it comes to maturity, diabetes doesn't automatically make a child more mature, but it often gives the responsibilities early in life,
Yeah.
With the right support, whether from family or from the school, many children develop strong skills in responsibility, problem solving, self-awareness, but still keeping the need or the space to just be a kid,
Yeah.
So you are mature, but I would say in a medical way, but emotionally, and your needs are still a kid need, you need
Yeah.
the sweets,
Yeah.
you need everything else, but at the same time, you have to be responsible
Yeah.
medically because these have consequences. So yeah.
Okay. Okay. So when you think about how to find a trustable material to inform school staff, students, and other parents about type 1 diabetes, I think by going to the kids IDF website and looking for the kids materials, it's a good education resource. Why? Because I did the school outreach, and then I love Tom, the comic one, and the kids love reading them because it's really simple and easy to understand. So another question is about the Kids and Diabetes in Schools program provide very useful and trustable materials developed by clinical experts and people living with diabetes. So how do you think this program and its materials can support improving the well-being of children living with diabetes in schools? Who want to go first? Dania? Because you're on my screen.
So finding the material, I would say now the material is more available, giving the programs that are initiated and the awareness that is developed from. But during my time, or me as a kid,
Yep.
we didn't have much of these materials, we didn't
True.
have much of these, the comic books, the cartoons, the characters. Or I would say our parents, my parents, they did not have access to such materials online. But I can see
Yeah.
nowadays it's totally different. Everything is available, and which makes life so much easier to implement as a teacher in a school, finding the program already
True.
ready for me to use. So yeah, I would say now it's much more accessible and easier.
Agree. Estefania, want to go? You want to go first?
Yeah.
You want to go second? Yeah. Okay.
I think all this material helps everyone. I mean, the students, the family, the teachers. I think it brings security to everyone, and in that way, we as kids, we go through all the school time. I don't know how to say, like, accompanied by others, and we can be secure inside our school. And we know that school is like a second house for us. So I think it's so important to have all this material.
Yeah.
to make our school period easier as again as students, as families, as teachers, because many times, and with this I conclude my answer, many times all the teachers are like they don't want to be near someone with diabetes because they don't know what to do, and they have a lot of fears, and it's obvious, it's okay, but if they learn, they can have
yes, but having the book,
exact, exact.
Yeah. Okay, thank you, Estefania. Ousman, wanna go?
Yeah, like about materials, just as Savita say, like it is the school is the second home. Yeah, after the home, then school is the second home. So with the materials, for me personally, I go with like the knowledge. Knowledge is so powerful. It's so powerful that without knowledge, you cannot have the good use of those materials. I think it is the first material that we can use to go on with the schools, the knowledge, the diabetes knowledge, especially type 1, because like most of the type 1s are diagnosed when they are so young, going to the nursery school and primary school. So I think it is also very important. We also have like the technology that makes diabetes management so easy. That is the CTMs and so many others. But like in Africa, we have one problem or two, that is the affordability and the accessibility of those materials. I think like in Africa, it's a big problem to have that. So I think it's also very difficult to give those education and to make the child like diabetes management so very easy. So I think the knowledge is very important, and it is so very powerful. We can use the knowledge to change the world and to change the lives of children going to school, to make it more easier with teachers and also classmates and schoolmates. Yes.
Thank you, Ousman. Naser, your turn.
I'm not sure I have a lot to add. Just I haven't been applying the materials of the kids program specifically, but when I used to be in school as a teacher, I had students who are diagnosed with diabetes to present what they wanted to educate people about. So what annoyed me the most was when people did this. When I do this, I prefer if people do this, right? So I think potentially the feedback I got from my students was a lot of the time that it was impactful. It was something that they felt very
empathy.
They felt empowered by, and that's the experience I had in school as well. I used to present the material as well as a student. But I think having material that's also ready, and as Dr. Calliari has mentioned, it's something that's already validated, and we need cross-cultural validations as well. So it might definitely be something that's useful.
Okay, we have two bonus questions for you, Naser. Coming from your professional perspective as a psychologist. Okay, what are the most common emotional challenges you see today in students, and what signs should educators watch for that may indicate emotional burnout, anxiety, or distress in students with diabetes?
I think what we commonly see is something along the lines of diabetes distress, which, research in diabetes has shown that this is the construct that very likely kind of mirrors or reflects what a lot of individuals diagnosed and living with diabetes struggle with. And it's this sense, what Ousman and what my colleagues have also spoken about how it's the sense of emotional exhaustion related again to the constant monitoring and responsibility of having diabetes and having to deal with diabetes on a daily basis. As you've mentioned, it's a 24/7 job. Something else that Ousman mentioned was a lot of anxiety, and that's something I usually struggle with as well. There is a lot of anxiety around hypoglycemia, because the hypoglycemic episode is obviously a very strange experience, and we're worried obviously a lot of the time with long-term complications. A lot of the kids are not sure, okay, I have diabetes now, am I still gonna have the complications that come with it? A lot of kids that were in my clinic I met were a lot of the times worried, and that's something Dania has mentioned, of feeling different, especially if diagnosis comes a bit later, such as 13. A lot of the times there is this worry about being different. That's not an experience I had myself, and I think a part of it came from my early diagnosis, but a lot of the
Yeah.
individuals got diagnosed around 10, 11, around teenage years. There is this
Yes, which years, yeah.
feeling, yeah, constant feeling of
Yeah.
kind of being different from their peers.
Yes.
And then when they're good diabetics, according to our doctors, a lot of the times there is a lot of shame or frustration that comes with
Yeah.
glucose control not meeting our expectations. So why is my range not in the 90%? Or why do I have a lot of hyperglycemic episodes? So obviously that contributes to this emotional burnout a lot of the times, which we
Yeah.
see a lot of the times with adolescents. I had kids in my in the clinic where I saw there was a lot of the times there is avoidance of self-care. There is a lot
Oh,
of
I see. Yes.
I want
Yeah.
to be independent. My mom wants me to take all of these medication. I don't want to take it, but there is an ongoing need for adult support. So managing between the two can sometimes be quite difficult. And that's why we see, and that's not obviously a deterministic look, but a lot of the times we see that individuals with diabetes, especially adolescents, are potentially more prone to depression and anxiety. And that's because of, again, the emotional toll that comes with the management of type 1 diabetes. Yeah.
Yeah. Wow. That resonates a lot because I was diagnosed when I was a teen, and when I was diagnosed, I feel really lonely and I feel different. Yeah, same thing like Ousman. I hide myself when I do injections and such because I want to be accepted in the community. Whew. Okay. One more question for you. What does a psychologically safe classroom look like for a student managing a chronic condition like diabetes? What does a psychologically safe classroom looks like?
So obviously one of the recommendations that was done recently was the kids program, and it has designations of and recommendations for what a safe classroom for individuals managing diabetes can look like. What I've seen is also when students don't feel like they're singled out, right? They're
Yeah.
not questioned a lot of the time for managing their classroom. So it's not like when they're
Yeah.
having small cupcake, a teacher would say, your mom told me you're not supposed
Yeah.
to have this
Yeah.
cupcake.
Yeah.
So again, when kids feel singled out, it increases their shame and
Yeah.
frustration. So
True. Yep.
psychologically, it could be an unsafe environment, as we can call it.
Yeah.
Something else is there is flexibility around blood glucose checks. So when the kid feels like they need to measure their glucose levels, there is a designated area, an agreement that they reach with their teacher, with their school about
Yep.
glucose checks, about snacks, about leaving class without drawing a lot of attention. So the teacher, I had one of my teachers, she was a really nice teacher, but she would jump out of her seat every time I would go to the bathroom. She would ask, is everything okay? Is your body hi? I'm like, don't do
Oh.
that. Don't do that. I appreciated the care, but sometimes the response,
Yeah.
can be a bit exaggerated.
Oh. Yes.
So I think also using very neutral, non-judgmental language, and obviously that's something that takes a lot of practice. And I know maybe I'm describing a very
Yes.
ideal situation, but maybe progress also counts.
Yeah.
I think also
Supportive environment as well. Yes.
definitely, definitely,
Yeah.
like having that, I think, clear and predictable procedure around, an
Yes.
agreement with the teacher, an agreement um, with the school around if the kid is not comfortable with being outed with
Yeah.
people
Yeah.
knowing
True.
about diabetes, they
Yeah.
shouldn't. So having kind of clear and predictable procedures in place, kids not being defined by their condition, right?
True.
A lot of initiatives are coming up, the kids program being one of them, about how we can
Yep.
bring this education into classrooms and give
Yep.
kind of autonomy to the child in class.
Okay. Yeah, this conversation really provides me flashbacks on what happened to me earlier when in my kids' years.
I'm glad
Okay.
it's doing that, Anita. It means it's real, it's not theoretical. I'm glad it's doing that.
Yeah. Yeah, it's like the flashbacks happening during this conversation. It's like I'm trying to hold on with my emotion right now. Okay, question for Steffi. What kind of support from teachers, school staff, and peers can help boosting a child's confidence to manage their diabetes openly at school?
I think, first of all, support this child.
Yes. Agree.
Then, perfect. Then it's important to allow these children to leave their diabetes inside the classroom. I mean, if they have to check the blood sugar, if they have to eat because they have a hypo, if they have to inject their insulin, they should do it inside the classroom. If they don't want, obviously they can go to another place. But sometimes here in Argentina, we hear that, for example, the teachers say, well, go to the director office to inject your insulin or to measure your blood sugar. And when you are a little kid, your mates, they start thinking, what is he doing? What is she doing? Where is she going? Why is she leaving every day our classroom at 10 a.m. in the morning?
Yeah, making us feel different.
Exactly, yeah. So I think the most important thing is to work together, the school, the teachers, the families, to leave this diabetes at school normally. I mean, if I had a hypoglycemia when I was 6 years old or 8, my friends, they knew that they had to give me a little bit of sugar. So in that way, it's an easy way to live with type 1 diabetes. I don't remember where, but I read that we have to take 180 decisions every day just because we have type 1 diabetes. Then we have to make a lot of decisions just for the people and live. But 180 decisions per day just for our diabetes. So our school should be a safety place for us.
Yes, for us.
Yeah.
Question for Dania then. Okay. I'm trying to collect my soul. Trying not to be emotional. Okay. Some people have this perception that children living with diabetes have worse academic performance due to their condition. What do you have to say about this, Dania?
Thank you for the question. From my personal experience, having diabetes does not automatically mean a child have worse academic performance. In fact, I used to have a very academic performance, but the person who is behind this performance was my mother. She's the one who used to ensure that I'm well equipped. I had my snacks, I had my breakfast. I'm well prepared for the exam, basically the stress, the burnout during the exams. I have my sweets in my pencil case. I have everything that I need to be ready in order to have my exam safely, my performance not to be affected. Managing the blood sugar levels, dealing with the fatigue or the illness can sometimes affect concentration during the lessons, during that. Yes, it does have an effect. With the right support from family, school, now healthcare providers, children, your peers, this is something that can be managed. And in fact, many children develop strong time management, problem solving skills, resilience skills because of these responsibilities they manage daily. So what matters is creating an environment where they feel supported, understood, which needs a multidisciplinary approach from teachers, doctors, peers. Yeah.
Yeah, true. I completely agree because I always believe that we have the same competencies like any other kids.
Yes.
We have the same competencies. We're even much stronger.
I believe that too.
Dr. Eduardo, you would like to add about the academic performance?
I believe that's important that you, like Dania said, that the competencies are the same. I mean, the capacities are the same. The problem is that a child with diabetes, they are facing issues that might prevent them to have their best ability to learn. So first, the psychological environment. So if you are worried about what's going to happen, if people are going to treat you differently, you're not going to pay attention on what's going on in the classroom. Secondly, regarding the control, it's been proved that not only hypoglycemia, because everybody thinks that hypoglycemia prevents a good brain function, and it's true, but not everybody knows that if you have glucose above 200, it is also related to less capacity of the brain to function well. So if you're doing a test and you have glycemic control, like glycemia over 250, 300, you're not going to do the same test as you would do if you were with a good glycemic control. So glycemic control, both acutely and chronically, we today know that if you are chronically in not good control, in the end, it might prevent you to have all your brain ability to work well. And the last one is the task. Sometimes you have a good student, just like the others, but they keep on going out of the classroom because of high glucose, to go to the bathroom or to take glucose. So all of those things have to be in good control, both psychologically and also having good glycemic control. So this is fundamental for us to understand, because we're talking about psychologically, and psychologically we understand how people react, but we have to understand also that control is something very important, which means that the whole environment, and then it's important for the teacher, for the peers to understand what's going on, but it's also important for the family not to, sometimes they have the objective of having 200 or 300 because they are trying to avoid those. And this is not also so good for the child. So it's the balance. We have to have things in balance so the child can have this capacity to use the brain as they are able to. So now we have all the professions. We have people with diabetes in medical positions, in engineering, in all, and even athletes and everything. So I believe that for them to use their full capacity, we here really have to make the environment be something that enables them to develop all the brain capacity.
Thank you, Dr. Eduardo. It's brilliant advice. We have to balance everything so we can reach our competencies. Sorry. So another question, which type of policies do you think we need to create an environment free from stigma and discrimination for children living with diabetes? Estefania, I want to answer that.
Yes, I think we can speak another hour and a half about this, but I will also only say that we have to speak more about type 1 diabetes. We have to speak more about this condition, not only at school, but also in the society in general. Because as I said before, the world is not ready for us. And sometimes it can be a little bit rough to live with type 1 diabetes. Because of all the stigma and discrimination that Ousman and everyone mentioned before. But I think that we have to speak louder and share our diabetes with everyone. It doesn't matter if we are a little bit, I don't know, embarrassed or something because of our diabetes. We need to share it, because otherwise no one will know what is to live with diabetes. And when you are injecting insulin, waiting for the bus, everyone will be like watching to you, like, what are you doing? And I think we should speak louder. And that's my first idea with that question.
Yes, we have to speak louder so people understand and know.
Yeah.
Okay, what was the most important thing, experience, or event you think you missed during childhood due to diabetes? I think it goes to Ousman. Yes.
Thank you for the question. I think I missed a very, very, very great final. It was the school final, my last year in high school. Then I missed a very, very important final. I played the whole tournament, but I had hypoglycemia just few minutes before the match. And the coach just said that I couldn't play the match. I told him that I'm already prepared after the hypoglycemia, but I missed the final and we end up losing the final. And I'm still crying for that trophy, but all is well.
Yeah. So there's another extra question. and then the room will run a few minutes over time. So apologize to everyone. So the last one is like to finalize, please respond in just 20 seconds. What message would you give to a child with diabetes that is struggling in school today? I'm losing your voice, Ousman.
Hello? Yes,
Yeah,
are you
okay.
again?
Yeah, got it. Yeah,
Yeah,
yeah.
the message that I have to give is that, like, as a small child, living with diabetes doesn't mean that your life is ending. You have to beat diabetes before diabetes beats you. Yes.
Okay. Estefania.
I would say that you're going to have a great life. You need to study.
Yay!
You need to approve all your exams,
Yes,
and you have to move on also with diabetes to have a happy and healthy life.
yes. Dania.
I would say that you're special. Diabetes is a part of you. It's not something to be ashamed of. Treat it like a best friend. Listen to your body, speak up for yourself, and never be silent about your needs. You deserve care, understanding,
Yes.
and happiness.
Yes. Mwah. Naser, your turn. Last message.
Yeah, I think I always struggle with like final takeaways, but I think what I would say is something around the lines of it's about your relationship with diabetes and how you treat it, and just thinking about how diabetes is a good friend. When you treat it well, it treats you well. When you don't, sometimes it messes up as well.
Okay. Don't cry. Okay. Okay. So as we come to the end of today's session, I would like to thank all of our speakers and panelists for their honesty, expertise, and commitment. Today's discussion reminds us that diabetes management does not stop at insulin or glucose levels. It extends into classroom, playgrounds, friendships, and self-esteem. Creating psychologically safe school environment requires collaboration between healthcare professionals, educators, policymakers, parents, and most importantly, children themselves. On behalf of the International Diabetes Federation, thank you for your time, your engagement, and your continued advocacy. We look forward to continuing this important work together and have a wonderful day. Sure. Okay, the closing remarks and thank you. The recording slides and feedback questionnaire will be sent to all registrants in a few days. Please respond to the feedback questionnaire to help us improve future IDF online events and send any questions you may have to kids@idf.org. So the next IDF webinar, Detect Early, Act Early, Improving Diagnosis of Type 1 Diabetes. IDF and ISPAD invite you to this online session to mark the launch of our joint policy brief on early detection on diabetes and screening. Thank you, everyone.